All of us know that the diagnosis starts by the clinical diagnosis or clinical findings. This is classified as symptoms and signs. Regarding the symptoms of obstructive uropathy, it has a wide range of no symptoms at all to the other extreme of acute renal problem. The degree of symptoms depend upon several factors, including the degree of obstruction, while it is complete or partial, time interval to obstruction, whether it is acute or chronic, etiology of obstruction, whether it is intrinsic or extrinsic, and the laterality of obstruction, whether unilateral or bilateral. Regarding the signs, it has a wide range of no signs at all in one extreme to the other extreme of having abdominal mass, volume, overload, and azotemia. These are the tools of diagnosis of obstructive uropathy, including intravenous pylorography, ultrasonography, radioisotopinography, spiral CT, magnetic resonance imaging, Whittaker test, antegrade and retrograde studies, and we are going to handle each of these items in some details. Starting by IVP, it is still the gold standard for detection of urethral obstruction, provided that the patient has a normal renal function with absence of allergy and a non-pregnant lady in the absence of pregnancy. All of us is aware about the normal IVP. This is the normal IVP. Here is the right kidney, upper calyx, middle calyx, lower calyx, pelvic circle, and bladder, and also normal left kidney. In acute obstruction, we may have the findings of obstructive or persistent nephrogram, delayed excretion of dye, no excretion of dye, or rupture of a minor calyx, rupture of a foramen. This is an example of persistent nephrogram on the right kidney. The dye is entrapped in the kidney without excretion into the pelvic axial system. And this is delayed excretion of dye by the left kidney. And there is here no excretion of dye, no excretion of dye by the left kidney. And here an example of rupture of the fornix of the minor upper calyx with extravasation of dye outside the kidney. For chronic obstruction IVP, you may have dilatation of the ureter proximal to the site of obstruction, and there may be marked thinning of the renal parenchyma. This is an example of marked hydrourethronephrosis on the right side due to presence of the stone in the pelvic part of the right urethra. Then the next item is the ultrasonography. Ultrasonography is very important in the diagnosis of obstructive uropathy. And there are various types of ultrasound in the diagnosis of obstructive uropathy. This includes grayscale ultrasound, diuretic ultrasound, Doppler ultrasound. Under the Doppler, we have two items: renal